with high maternal rates, and I'd like those graphics to run on the screen even as we share this information. Maternal mortality rates fell by only 20% over the past 20 years. The high number of maternal deaths annually in Uganda account for 2% of the annual maternal deaths globally. The major causes of maternal deaths are preventable, with the three leading causes being hemorrhage, obstructed labor, and complications from abortion. Almost 28% of maternal deaths in Uganda occur in young women aged 15 to 24 years. The overall adolescent birth rate in the age category of 15 to 19 years is at 135 per 1,000 live births, which ranks among the highest in sub-Saharan Africa. Having a cadre of highly trained medical interns and professionals can dramatically reduce the number of maternal deaths. Implementing maternal health programs like the essential training in operative obstetrics at scale will avert an additional 57,600 maternal and newborn deaths respectively, and will translate into reductions in maternal mortality rates. Well, let's meet my panel for tonight. I'm joined in the studio. I'll start with Prima. Prima is to my very right. Prima Kwagala is a program manager, strategic litigation program with CEHAD, which is Center for Health, Human Rights and Development. Welcome, Prima.
Thank you, Josephine.
All right. And then we have Dr. Sembatia Henry, who is an obstetrician and gynecologist with Mulago Hospital. Welcome, Dr. Henry.
Thank you, Josephine.
Okay. And finally, Dr. Elizabeth Biakwaga, who is a senior house officer in Mulago.
Thank you, Josephine.
Thank you for coming. Let's say it as it is. Well, in 2013, there was a renewed promise, a sharpened plan really for Uganda, and that was in November 2013. The plan was from a renewed promise to increase efforts in districts where half of the deaths occur, prioritizing budgets and committing to action plans to end preventable deaths, scaling up access for the underdeserved population groups, educating girls and women, empowering women to make decisions. That was in 2013. 5 years later, 2018. How are we doing? Can we say we've kept that promise to scale up? Where are we?
Yes. I think we have. Currently we are increasing the training as a country. I think we have opened up more medical schools, which is paramount to increasing the resource, the human resource, that will enable a mother, when she's pregnant, be able to access care from wherever she is. We are building more structures as a country. As you can see in the city alone, there's Chirudu, there's Kawempe, there's the newly built maternal hospital, and I think this is all in a way to help scale up the care when a mother comes to hospital and she needs care. Okay. And I think last year, though it was after a struggle, that the government decided to improve the pay of a medical worker, which I thought for a long time was long-standing, that a medical worker was earning way less than any other maybe person that was working in the private practice. So it was causing a drain on the system, that there was absenteeism, there was a lack of motivation. So in a way it helped motivate the health workers and also increase the numbers of people that are available when a mother comes to hospital.
To the hospital.
Yes.
All right. Prima, what do you think?
I wouldn't say the same. He's in the practice and can share that for sure. But coming from an ordinary citizen perspective, I wouldn't say there has been progress in terms
at
of
all.
Well, it could be situational. In Kampala, there is progress, tremendous progress. There's health facilities coming up all over the place. There's doctors who wish to only practice in Kampala, but make your way to Mutiana. There's nothing like that. If you look at the current Uganda Demographic Health Survey, the statistics have not changed in the past decade. I'm sure you've heard of the old adage that good policies and laws are made in Uganda and
implementation is the problem.
Or something like that. You will see health workers. There are health workers in Mulago, but go down to Kabon, there are no health workers in the facilities.
Dr. Biakwaga.
May I say there is something that has been done, considering that the maternal mortality rate in 2011 was about 423, and currently it's 336. It may be a small decline, but it matters, considering the family planning rate has been, like the contraceptive prevalence rate has increased to 39%. It may still be low, but there is a mother who has been saved out there. So we can't say that nothing has totally been done, but probably we need to do more, take an extra step, because 336 is still really high. So we need to take an extra step, maybe introduce more training, courses. Recently we underwent...
I think like she says that these things are being done, but they're in one place. In one place.
I think I disagree with that. I think there's training institutions that are being birthed. There's Gulu, there's Soroti Medical School, there's Kabale that came up, there's all this. Okay, they may have a challenge right now with the training system, but I believe with setting up of these training institutions is to help improve the human resource. And I think if someone is trained in Kabale, if someone is born in Kabale, they're likely to get back to Kabale and work in Kabale.
I want to think so as well, that we want to go back home, but I want to think what is at home for me. What's the pay? Is it the same as what are the circumstances?
Absolutely. You might also know the government invests a lot in training, that I have no doubt. But the same government wanted to import or export these doctors to Cuba and bring in Cuban doctors to treat us. I have received complaints from medical interns. They don't want to be posted out country. They want to choose where to work. Most of them want to work in Mulago, most of them want to work in Bengo, most of them want to work in Rubaga. What does someone who...
I think now that's the challenge with policy, where we need now to put policy. What's the benefit of me working in Kabong as compared to someone working in Kampala? I think that's where now we need to sit down and discuss as a country that what's the benefit of someone working in Kabale as compared to someone staying in Kampala, or someone working in the West Nile as compared to someone in Kabale. I think that's what we need to discuss now, because I think that will attract more doctors.
You know that they say that insanity is when you keep doing the same thing and expecting different results. What new thing are we doing?
What new thing we are doing? I think the first thing that has been running on media, I think, has been the pricing of the new hospital.
I was coming to that, but since you want to go there now,
which so many people are complaining about,
yes.
But I see it as something really beneficial to a country.
Tell me about that benefit.
Okay, I can give you an example. If I went to West Nile, Western Uganda, to take a woman, a wife, they would give me a bride price probably of 10 cows or 20 cows.
Do you want to use that example?
Yes,
and bring
I'm giving that example is this, because
I think let's use an example that
we can relate with.
Yes, let's not use.
So what I'm saying is the perspective of our country, not just the government, the Ugandans, has been that healthcare is cheap and it's free, and that has cost us so many lives.
I don't think that has been the
I think that has been the perspective.
Because healthcare is free.
Yes.
Every person thinks healthcare is free, and they don't they don't become responsible enough maybe to save something for their health. They just know they can walk into a hospital and health will be provided to them.
But
and yet
the president has told us.
And I think
it's free.
Probably
you can go and receive it.
Probably we need to consider
cost to it.
Yes.
So now that's why consider introducing the health insurance.
That's why I'm talking about the newly renovated maternity women's hospital. That it has set up the prices. I don't know, I was not in the discussions, but I've seen them in newspapers. And I think now the country needs to sit down and say, this is the cost of a C-section. This is the cost of giving birth to a baby. How do we do to afford these costs? What do we do to afford these costs? And that's when we come up with ideas on how to make healthcare affordable, but quality of healthcare is provided. And I think when the president gave people free access to healthcare, I think in the long run it has cost them, because it might have been a political perspective to give people access to free healthcare. But the people that are in the system know this has failed, because other countries are not doing it. Even the best of the best, USA has no free healthcare, because healthcare is expensive. It's not like a school that you build and then put up blackboard and people teach. But you need to buy sundries, you need to pay cleaners, you need to pay health workers. You need to pay nurses. You need
to buy drugs.
You need to buy
I know
drugs.
that we're going to come back to this conversation on the newly constructed hospital and the fees to it really, but I don't want it to be the conversation we stick to. I would like us to really talk about our situation in the country. So they say that 80% of these deaths that happen from maternal health are preventable.
Yes,
Yes, they are.
So what exactly is happening? Why do mothers go in and die? There's severe bleeding, there's low and high blood pressure. What are the common things that we hear about?
I would say usually sometimes mothers come, they have a complication and probably there are no sundries to use, or you do not have the drugs. For example, for hypertension, you may not have the medicine for high blood pressure, like probably magnesium sulfate or hydralazine, and then you're asking the husband to go and buy. Sometimes they have not come with the money to buy the medicine, and the husband has to go and buy the medicine, and that's another 30 minutes, and it's an emergency. So that's one of the reasons why probably we have not been able to reduce this maternal mortality.
Do you think our problem is that we don't have access to healthcare services, or that it's too expensive for us?
No, I think there are 3 delays that cause these maternal deaths. One is a delay in seeking healthcare. The public is not aware that this is a complication, that I need to go to a facility and get help. The other is delay in access, in reaching the healthcare, the place where they can get help. And that can be seen in broken down referral systems that have been existent, lack of ambulances. There was a lady in Kamuli, you can watch a YouTube video, that passed on because she had a retained placenta. And that could be done in Kamuli, but she was referred, there was no ambulance, she took a taxi. By the time she gets to Jinja, she's dead. So, and then the other was access in intervention, where a mother comes and maybe the health person that sees her is able to take charge of the condition that she has. So I think those are the 3 delays, and in all this, policy plays a part. It plays a part, and like the essential training in obstetric emergency care.
Like that he has mentioned the issue of policy, because our government has been very proactive in putting in place policy. Recently they came up with a policy on sexuality education. Now, in giving sexuality education to children or adolescents, because we know that 25% of teenage pregnancies are happening in Uganda. That is the highest percentage in Eastern Sub-Saharan Africa. But we are not providing contraceptives to these young children. The president has come out categorically to say contraceptives are not for children. We have statistical information and science to the effect that by the age of 15, Ugandan adolescents have had a sexual encounter, but we have not equipped them with the information. Last year, Parliament came out and categorically banned sexuality education until they put in place a policy. Now, that
and we
policy
say that
just came in
28%
recently.
of maternal deaths in Uganda occur in young women aged 15 to 24.
But we cannot give them contraceptives. We cannot provide them with service. Abortion is
should
illegal.
not run away from the idea that we are a young population.
Yes.
50% of Ugandans are age 15.9. We are a young population.
We're not disputing that.
Yes.
It's just that where are we in then this discussion on helping these young people?
Where do our
It's true, we need
priorities
to
lie?
really emphasize sex education, because most of these teenagers, if they get pregnant, they are liable to die, to get complications of pregnancy and then die.
Or
So
even
sex
go and try to have an unsafe abortion.
an unsafe abortion. So we really need to emphasize on sex education, and also provide family planning services for everyone, including tell everyone that they can access family planning.
I think that is a bit controversial, because are you going to walk into a school and maybe put up condom statues in a school?
Youth-friendly services. We
No,
don't
you don't have to put up condoms in a school, but
Because-
you tell them that there is an option of using a condom.
Yes, I think training is okay, and students, I think I got to know about contraceptive measures way early.
At what age?
I think I was in my S1.
About
Yes.
13.
Yes, about 13 years.
How did you
And I was I was learning about it in biology. It's not that these students don't know about these things. I think the main issue is how maybe the
How do they get the information? Where are they?
Where can they get
I'm going
the
to
information?
cut you short and we'll take a break, but we'll be right back and continue with this conversation. Okay.
Saloons. We offer professional barber, hairdressing at Lugogo Mall, Garden City, Forest Mall, Oasis Mall, and Acacia Mall. Sparkle Saloon. Professional, affordable, and quality services.
Every woman and girl has the right to live a life free of violence and discrimination. Leave no one behind. End violence against women and girls.
We have to put up condoms in our school, but you tell them that there is an option of using a condom.
Yes, I think training is okay. And students, I think I got to know about contraceptive measures way early.
At what age?
I think I was in my S1.
About 13.
Yes, about 13 years.
How did you?
And I was I was learning about it in biology. It's not that these students don't know about these things. I think the main issue is how maybe
how do they get the information? Where are they?
Where can they get
I'm going
the
to
information?
cut you short and we'll take a break, but we'll be right back and continue with this conversation. Okay.
Saloons. We offer professional barber, hairdressing at Lugogo Mall, Garden City, Forest Mall, Oasis Mall, and Acacia Mall. Sparkle Saloon. Professional, affordable, and quality services.
Every woman and girl has the right to live a life free of violence and discrimination. Leave no one behind. End violence against women and girls.
The Big School Fun Moment.
It takes hours of training to glide like this. Big Crystal is made to glide like that. Big Crystal, it makes the grade.
Distributed by African Queen, #1 Distributor Limited.
Wow, this is classy, elegant, magic, mystery and delight on Classic Bouquet. Classy entertainment for ladies, Novella E+, Ebony Life, Nollywood Plus and channels. For children, Baby TV. And for
of child marriages in our community. As your leader, my dream is to stop child marriage in our community. Please, join me and let us do everything possible to turn this dream into a reality.
True. Fellow parents, one way we can stop child marriage is by supporting our daughters to concentrate on books before babies. Let our girls be girls. Yay!
Parents, support your children to stay in school. Marrying off children affects their education and prevents them from realizing their dreams.
For more information and counseling, call the toll-free number 0800 200 600. Live your dream.
This message is brought to you by the Ministry of Health with support from UNFPA and Korea International Cooperation Agency.
Live your dream.
From the Kampala Serena Conference Center Nile Room, and we're talking maternal health, and we're wondering if Uganda is keeping the promise to its mothers. My question now, do you think that our health budget is getting the funding that it deserves?
No.
It's not.
At the very least, I think you agree on that one with them.
We agree.
Okay, so you don't think it's getting the panic it deserves. Why should pregnancy, giving life, be a thing that has to compete with everything else that there is to compete with?
Because I think life is our posterity. It's what sustains our being here.
Yes, so I'm wondering why it has to compete. In terms of a budget, we know that we need money to actually inject into these health centers. We need money to take care of these people giving birth, these children who are being born. Why is it not getting the attention it deserves?
Probably they don't think, I wouldn't want to say they don't think health is that important, but
it would be very sad if that was
because a healthy community is a healthy country and an economically stable country. So, well, I may not know the reasons why.
Why do you think, Emma?
Priorities. Politicians have not made priority of mothers. You may remember recently, at the beginning of this year, we were struggling with blood. Not too long ago, we buried our sister Nuliat. She was one of you in the media.
Yes.
She needed blood during her operations, and she was lucky. She could go to an expensive facility. She had insurance, but there was no blood in that facility, and her husband had to swing around the whole town to find a pint of blood for her. Unfortunately, she did not survive it. And that is the story of too many ordinary Ugandans, health workers.
And I think pregnancy should not claim life, really. It's natural, it's a right.
It shouldn't.
Like, it's a right for someone to give birth. So, and you find that the statistics, if a mother dies, the likelihood of that baby dying is 3 times.
Yes.
You see, so it's, and the family surviving. Most of us can tell you for a fact that maybe we went high in school because our mothers were proactive. So I think it's very valuable. It's something to look into as a country.
I think it's
something not to take for granted.
People forget that these two are related. Childbirth and actually a child actually surviving. It's something that they very quickly forget. I'd like to take a few questions from our audience before we actually go further in the conversation. Yes.
Thank you very much, my name is Rita Achiro.
Rita, if you could stand up so we could get you.
Thank you. My name is Rita Achiro. I work with the Women's Rights Organization, and I'd like to thank the doctors and my sister Prima, but I also sympathize with the doctors that you've been pushed against the wall. We should have had a politician sitting there to answer some of these questions. Dr. Sembatia clearly articulated that the major contributions of maternal death are the 3 delays. Delays at home, delays on the way, and delays in the health center. At home, we need to know what happens at home. The gender dynamics, the power relations. Can I decide when to take family planning? Can I decide the number of children that I can have? Can I decide when to go to hospital? On the way to hospital, what type of facilities are we using? Are the ambulances there? What type of roads? At times when I drive up country, for about 2 hours, you don't see anything like a health center. And the first thing that always comes to my mind, what if a woman starts bleeding in this environment? What happens? So the infrastructure that leads us to the health center is a problem. And that's why I said we needed a politician. The other issue is the health institutions or the facilities themselves. I don't know the ratio of patient to doctor right now, but I know it's very high. It's one of the highest. When a mother gets to hospital, do we actually have the right trained nurse, doctor at the facility? Doctor said at times you don't even have the equipment to use. You've talked about hospitals around Kampala, but even Mulago, right now women are paying for switches, for gloves. You have to go with everything. So what about the woman in Kisoro? What about the woman in Kabong? What about the woman in Yumbe? I think the issues of maternal health have to be answered politically. The doctors can only do their best. My question to you doctors is, what are you doing? Because I know many of the doctors are running from one hospital to another trying to make ends meet. But if your environment of work is not facilitating your work, and you are equally keeping quiet and trying to say these things in nice ways, nobody's going to speak for you. Thank you very much.
Thank you very much, Rita. Would you like to respond?
I think last year the doctors came out. I think that was all over media. Doctors came out and said enough is enough. We are tired of seeing a mother bleed. And we came out concerning pay, we came out concerning sundries, we come out. And I think that's the thing I was addressing initially, that we need to put up a health system where people contribute to their health care, however little it may be. It's important that even the person giving birth feels a part of contribution to their health care. And I worked in Nakaseke District Hospital at one time, and there the patients pay a C-section, 60,000. Not a lot. It may be a lot for someone, but 60,000 shillings for a C-section. But even up to now, we are no longer getting referrals from Nakaseke District Hospital. And that's where it comes back to policy, that the government needs to come out and say we cannot afford free health care. Let us put up systems that can be able to pay for this health care. Let's put up a national health insurance scheme. Rwanda has it, and it's having a very good health system. Kenya has it, it's having a very good health system. So why don't we put up such initiatives to help motivate our staffs so that our doctors don't run, so that people don't leave Uganda to go to India to get health care from a Ugandan in India? I think that's absurd.
Because it's even sad that the standard care a patient should get. Me, myself, I cannot afford it. I'm a doctor, but I cannot afford it. Neither can my children, if I ever have.
And even the free care that is supposed to be there, by the time you can actually access it after going through the lines, you're dead. So
because of the numbers, and people have been told it's free, that's what has created a problem. If we can put a system in Rwanda, I think their national health insurance helps them contribute maybe 80%, and the person maybe contributes maybe 20%. So you find that the people are responsible for health care. And I think that has bettered the health care.
And I know we don't have a politician, but I'm glad that you are here. At least we can get to hear from the doctors where exactly the problems are. I'm not sure what difference it would have made to have a politician, because it would most likely be politicking. Prima, yes.
Yeah, I just wanted to say that the discussion for a national health insurance scheme has been around for quite some time, and the Kenyans are also rolling it out. Imagine, come to think of the fact that now we are paying OTT and that tax that we are collecting. Come to think of it, where do all those billions go? Because people are actually paying that money. If we had to pay that 0.5% to go towards maternal health.
Do you think that we should be spending money building new facilities instead of equipping the health centers that we already have and putting, you were talking about sundries.
Yes.
Deep down in the villages, shouldn't we be focusing on getting...
Deep down in the villages, you may even have a structure, but you don't have the equipment.
Yes, so shouldn't we give that attention?
You don't have the anesthetist. In most cases, they have the doctors, they have a functional theater, but they may not have someone to give anesthesia, so the theater will not be functional. So there are really so many things we really need to tackle to make sure we bring this problem down.
Okay.
I think putting up structures is important. You cannot run away from it, because if you have a bed capacity of 20 beds and you're attending to 100 mothers are going to be on the floor. So putting up structures enables create space for these mothers to be attended to. But also these structures need to be put up in a systematic way. Honestly, if we just put up shady structures, they're going to be broken down in the next 3-4 years. And then you'll have to renovate and spend money on renovation instead of injecting this money into helping mothers. So I think we need to prioritize healthcare, and then we need to know how to mitigate the problem that we have as health institutions.
Okay. Well, somebody once asked, and like Rita from the audience has mentioned, somebody asked what is the one thing that mothers should have to help themselves? And they said power. That a powerless woman is not really going to do anything for themselves.
About that, many women that I've interacted with in Mulago, they always have to wait for someone to make a decision for them, either the mother-in-law or the husband. So I think we also need to empower women more, so that they know their worth, because they're the ones they are like the pillars of our nation. If you have no woman, you literally have nothing, because they're the ones who do most of the work They're the ones who take care of the children, make sure the children go to hospitals, go to school, provide food. So basically, we need to take care of our mothers.
I think that's very true, because you can find a mother that has delivered 10 children, and you're asking her, should we do a tubal ligation? And she says no. Why? Because the husband will complain, or the husband will divorce her. So I think that women need to be empowered, because a woman's health, and when she's giving birth, she's the one at risk. She's the one going through all this labor, and a husband has to decide on all that, whether for her to have a tubal ligation or not. I think that is really absurd.
Right.
Yeah.
And I think the question of power,
just very quickly, yes.
Yeah, is really important, even in terms of demanding for a service. Because if I have come for a checkup, really, you should look at me and see how my pregnancy is progressing and advise me on how I should deal with that. But I've handled cases of women who have gone to Mulago Hospital, given birth, and discharged without babies. Without babies. Without the baby. Yeah, and you're asking, what did you tell the doctor? But they told me the child has got lost. As in how I have a case. I know you're both from Mulago, so you're
Two UPDF officers arrested by Kenyan authorities for pursuing fish smugglers across the border. Never give up. Hear the inspirational story of Joseph Sekandi, who rose from being a security guard to becoming the Dean of Nkozi University's Faculty of Agriculture. Also on NTV Weekend Edition, a solar energy initiative helps health facilities in Arua offer more effective health care. And in Health Focus, understanding why Uganda still has a high maternal mortality rate despite different initiatives to save the country's mothers.
Don't worry, he'll be back. But why is he always spoiled? Well, today he's going to help build a dam. Why? So the dam can create electricity and Mrs. Mugisha's children can do their homework at night. Wow, Daddy does all that? What else does he do? He's helping to build a highway. No way. Now, Mr. Pio can transport watermelons and earn money for his children's school fees. Daddy helps people create new homes and grow their businesses. But I thought Daddy was a banker. Yes, he is. He works at Stanbic Bank.
For us, improving lives is why we do what we do, because a better tomorrow starts now. Stanbic Bank, moving forward.
Send money to your loved ones in minutes from as low as 6,000 Ugandan shillings and from a network of over 500 agent locations in Uganda to almost anywhere in the world, starting at a transfer fee of Ugandan shillings 6,000. Western Union.
All K2 customers will now be able to purchase an Airtel K2 SIM card and the number series 0708 at 2,000 shillings. All you have to do is present the following: original and valid national ID for Ugandan nationals, refugee ID for refugees, passport for foreigners, and get registered for a new 0708 line. No one can buy or register a line for another individual. Enjoy services on voice, high-speed internet, Airtel Money on the widest network, and the free caller tune of the Buganda anthem for all Airtel K2 customers. K2, powered by
Airtel, the smartphone network.
Is brought to you by
Star Times. Enjoy digital life.
Live from the Kampala Serena Conference Center now room, and we're talking about maternal health in Uganda. Some of the responses that we have on social media, I have Herbert Ozele, who says Uganda is still lagging behind compared to some of our East African counterparts. However, we have taken some steps in the right direction by building the new specialist hospital. Labila Sumaya Soke says, refraining maternal health from a mother's perspective, let us prioritize what mothers want. And again, Herbert says we need to admit that Ugandans cannot afford to give free health care to its citizens. That Uganda cannot afford to give free health care to its citizens. Uganda simply does not have the money to continue that. It would be a shame if the president made the specialist hospital free. Let's hear from our studio audience. Yes.
Thank you so much. My name is Charles Mugabe. My question goes to Simbatia, Dr. Simbatia.
Yes, please.
I want you to clarify on the current rates imposed on the people and the newly constructed Mulago Hospital.
I'll just take that away from him, because I would really not want it to be the conversation we go into on the new hospital.
Do you think the situation at Mulago Hospital is okay based on the current situation in Uganda? Do you think the facilities are okay to facilitate all the people who are coming there?
All right, Dr. Sembatia.
Okay, I think the current situation in Uganda as pertains to maternal health is not okay, because I work on these mothers daily and I see the pain that you have 20 scissors done in 24 hours. Mulago is like the busiest place in Africa. So I think we need to build more structures so that we have, we redistribute the work, and then we need to enforce the workforce. That we need workers that are motivated. I think that's one thing. For a long time, the country thought a doctor was worth 900,000 shillings, which was absurd. And up to last year, when the doctors actually came out and went on strike, is when the government came out and said, actually, we need to pay these people more. So I think we need workers that are motivated, nurses that are motivated, that can come and work and go back home and sleep, not come and work and then go and do a night shift elsewhere, so that they can come back tomorrow, they're fresh, they can attend to you, they can make good decisions when they see you. Okay. And I think we need to increase the budget, because I think WHO says 15% should go to healthcare, while Uganda is giving only, I think it dropped to 8%, which is also, I think, really absurd. So I think we need to engage the healthcare system.
Thank you. My comment goes to what Prima talked about. Doctors preferring to work in Kampala and living out to the up-country areas. As the ministry did to the education, the teachers, they created what we call hard-to-reach schools. If they apply that also to the health, I think it can encourage doctors to work up-country. Thank you.
All right, thank you. Would you like to add to his comment?
Yeah, but like Doctor has said, I think it is a question of priority and motivating them to actually be there in the upcountry facilities. It is indeed true that over 75% of Ugandans can access a facility within a 5-kilometer radius. Those structures are there, the solar panels are there, the health workers are not there. They don't have housing, the small things they need, like, basic medicines, sutures for women when they are delivering and all of that, are not in the facilities. If the government can equip these facilities, put housing for the doctors there,
okay,
the facilities will be functional for sure.
Yes.
Yes, my name is Rose Wachkona.
And my question goes to all the panelists. First of all, I wanted to comment about the baby thefts. We actually have 3 cases in court, one already determined in favor of the woman who lost a baby, and the other 2 are before judges. But my question today is about unsafe abortions. Statistics say that women who go for post-abortion care in Mulago Hospital actually take 24 hours more to receive any form of treatment from the doctors. And I wonder why the doctors take so long to work on women who have performed abortions.
Okay. I would say that's not true, because every day I provide care for mothers who have had abortions from somewhere and they come to Mulago with complications, probably sepsis or an incomplete abortion. So I would say that's not true, because
you would say it's not true that they spend 24 hours.
No, they do not, unless the queue is long and you have to work on all of them, but you can't work on them at the same time. You're one doctor, and
so is it just you?
Usually on duty it's one doctor.
So I think there are emergency wards in Mulago, and depending on where that mother gets access to. So when she gets to the gate, she asks, where do I go when I have this problem? And then they direct her maybe to level 6, which is now Kawempe. So when she gets to Kawempe, any bleeding woman, any bleeding patient
is a priority.
So you triage these mothers and see, this one needs emergency care, this one can wait. So you attend to the ones that need emergency care.
But if it's just one doctor, it doesn't, there's nothing like priority, because you're about...
Yes, now that's where the challenge
comes. Yes, because if the ratio of the patients to doctors is like 3-to-1, so some of them may have to wait a little bit longer than they should have.
I don't think 24 hours you can spend with someone bleeding for 24 hours.
But 24 hours, that's not true.
All right, the next question.
Thank you so much. My name is Faith Myra. I work with Breast Health Development. My question is about sexuality education. Down there in those rural areas, we're talking about these people being so young, but when we look at statistics, there are high levels of teenage pregnancy in Busoga region. So we look at these young people that we can't give them the services like Prima was suggesting, and you were going against it, but they're already doing it. They are already getting pregnant and dropping out of school. So my question to you is, do we ignore the impact of not empowering these young people because of the fact that it's just someone's opinion that we may not, it's not really good for these young people to have this sexuality education? Thank you.
I say that we shouldn't ignore them, and when a girl gets pregnant when she's 15, it doesn't mean it's the end of the world. They can give birth and they can go back to school. They can give birth and they can do something else. They can do...
I think she's asking about giving them prior information.
Oh, prior information.
Yes.
They should receive the prior information.
You actually were in agreement. It was Dr. Sembatia who was...
They need to.
I think the challenge is the perspective of a girl getting pregnant. In our society, we still carry that mindset of pregnancy is a criminal offense. That when she gets pregnant, you kick her out of school. Actually, schools have put up systems where they expel them. I think we need to change that. That she has maybe gotten pregnant, but don't kick her out of school. You're killing her future. So I think we need to tackle it in that area.
Also, Dr. Sembatia, I think you're avoiding the exact question, because I think she meant about contraceptives.
I don't think it's really good to go to a school maybe and put up, maybe, you've been to public places.
I also know that there are religious beliefs attached to some of these arguments. So sometimes it's easy for somebody to...
But it's a problem, it's there, so we have to face it. The teenagers are getting pregnant, and how can we face it?
All right.
How can we stop it?
I'm being told that our time is up, so I'll ask you actually to start us off and just summarize. What would you like us to take from this conversation, maybe in a minute?
What I would like us to take from this conversation is to know that maternal mortality is a bad thing. It's a shame, and to try and stop it, and by doing maybe increasing family planning, because we know family planning can reduce maternal mortality by about 49%.
Okay. All right, Dr. Sambatia?
I think I'll go back to the 3 delays. We need to empower people and let them know that once you have this, you have a headache, you need to go to hospital, you need this, you need to go to hospital. And then we need to put up referral systems, we need ambulances in place, and we need structures in place. And then we need to empower. The essential obstetric training course, I think, is very key. In training, we need to take it up as a country so that we train health workers, even in Bundibujo, wherever. When a mother comes with this, what do you do? I think that's very important. So.
Okay, and Prima, finally?
I'd say increase funding towards health and health facilities, motivate health workers to actually stay in these facilities and serve communities, because as they've clearly illustrated in their strikes, they are willing to actually do the work.
To stay in their country and do the work.
Yeah.
All right, thank you very much, all of you, for taking the time to speak with us. Unfortunately, our time is fast spent. Coming up is NTV Weekend Edition. Keep it NTV.
Monthly basic bouquet subscription of 18,000 shillings before it expires. Then enjoy 3 free days only on Star Times. Enjoy digital life. NTV, turning on your world.
Introducing Kiri Soda in 4 different flavors: lemon, mixed berry, orange, and Kiri Cola. Celebrate life with Kiri Soda.
Let's celebrate life!
Turn your car into a beast. Fill up with Shell V power to clean and protect your engine. Experience performance that excites.
This is it, this is your time. Time to live, time to shine. Making every second count. That's what life is all about.